Hi everybody, my name is Dr. Malik. Today we'll be reviewing an article by Dr. Jeffery Wilson. He's associated with Division of Allergy and Clinical Immunology at University of Virginia. This article was published in Journal of American Medical Association. And it was published on September the 2nd, 2021, so it's quite recent. I will leave a link to this article in the description below for anybody who wants to read it themselves as well. I will do a quick review of this article as I think it is quite important to know the difference between these two vaccinations that have become a household name nowadays. Everybody's aware that there's a vaccine called Pfizer. Everybody's aware there's a vaccine called Moderna. Those two vaccines have been quite famous, to say the least. Now, they're both similar vaccines because they are both mRNA vaccines. They have similar efficacy that was shown in the clinical trials and similar features. However, they do have different formulation and different storage temperature. So they are similar in ways and a little bit different in some ways. Now, in this study, they are comparing the Pfizer vaccine and Moderna vaccine and its response in different age group recipients. This is a cohort study, meaning they took 167 individuals in this study and they followed them through their course of being vaccinated. What they did was they used a quantitative assay for the immunoglobulin, so the antibody to COVID-19 receptor binding protein, to compare antibody response in the employee cohort. Now, in the method, it talks about different technological terms are used here because it kind of tells you exactly how they measured it. So basically, they took the cohort of 167 people, and we'll talk about the cohort in a minute. So they took the cohort and they analyzed all individuals who received 2 doses of either Pfizer or Moderna. They had blood samples drawn on day 7 to day 31 after the second vaccine. So post boost blood was drawn. Now, some of the individuals, some participants did have a baseline. That means that they had a blood draw at 7 days, within 7 days of first vaccine, or pre-boost blood draw as well. So both were compared. In the serum, the immunoglobulin 2 COVID-19 spike receptor binding protein and the nucleocapsid were measured, and then quantitative study was done using Thermo Fisher Fadia, and then it was graphed using a GraphPad software, and it looked something like this. We'll talk about numbers a lot more than the graphs, just because they are easier to understand. In this entire study, there was 167 people. Out of these 167, 79 were in the Pfizer group, so they received Pfizer vaccine, and 88 were in the Moderna group. Median age was about 43 for Pfizer and 40 for Moderna, so not a whole lot of difference. Age-wise, less than 50 were total 104 people, 48 of which had Pfizer and 56 of which had Moderna. 50 or more were total like 63 people. 31 of those had Pfizer and 32 of those had Moderna. So age-wise, not a whole lot of difference in who received Pfizer and who received Moderna. Gender-wise, in females, there was a lot more females as compared to males in this study. So 120 females. So 57 of those received Pfizer and 63 received the Moderna. Males were only 47, 22 of these received Pfizer and 25 received Moderna. Ethnicity, there's a lot more white ethnicity in this study. 61 people received Pfizer and 69 people received Moderna. Not a lot of Black, Asian, or other races, although in their comparison as well, there is no significant difference between people who received Moderna and people who received Pfizer. So only a few numbers, +6, I think, were the difference. When we're talking about result, right? So, only 6% of the participants had serological evidence of prior COVID, meaning they had evidence that they had been previously been infected with COVID-19, and so they had some kind of immunity or some level of immunoglobulins in their level in their blood. Levels of immunoglobulins to this were lower in recipients with Pfizer as compared to Moderna in both pre-boost and post-boost levels. So let's compare this. In this, we're comparing both of these vaccinations, right? So Pfizer and Moderna are being compared. And we're comparing pre-boost and we're comparing post-boost. In pre-boost, we have 5.9 compared to 19.1. Pfizer compared to Moderna in pre-boost. 5.9, 19.1. Okay, that's a difference of about 13.2. Post-boost in Pfizer, 45.9 as compared to 68.5. So difference, you can see in Moderna and Pfizer. This is an overall. Okay. Now let's talk about different age groups. That's what we're here to compare. So in different age groups, recipients who are 50 years or older received Pfizer. Pre-boost immunoglobulins were 2.1. Okay, 2.1. This is lower than the recipients who were younger than 50 and received Pfizer. So they're both receiving Pfizer, but people who are over 50, okay, our pre-boost is 2.1. People who are younger than 50, pre-boost is 10.2. So 8.1 is the difference. Okay. So 8.1 is the pre-boost, and then when we are comparing this to Moderna, similar age group, meaning people who are 50 or older, Moderna showed 14.7. Okay, 14.7. 2.1 and 14.7. Recipients age 50 or older who received Pfizer. We're now comparing post-boost immunoglobulins. It was 31 micrograms per ml. And in the younger recipients with Pfizer, it was 59. So 31 in older than 50 or older, and around 60, 59 in people who are younger. Now let's compare that to Moderna. Similar age group, meaning people who are 50 or above, with Moderna showed 71. So 31 and 71. Huge difference. Okay. So at the end of this study, there's this discussion, and it says the cohort study, we used quantitative assay to find out that Pfizer elicited relatively lower antibody levels in older adults versus younger adults, which is consistent with the emerging reports. By contrast, there was no difference in post-boost antibody levels in older adults versus younger adults with Moderna vaccine. One explanation for the difference, this is the point to be noted. One explanation is that there is different dose. So for Pfizer, they're using 30 micrograms, okay? They're using 30 micrograms as compared to 100 micrograms that is used with Moderna. So that could be the difference, because you're giving a lot of antigen. You are injecting a lot of antigen into the body, and so the response would be greater, because this is like 70 micrograms more than this. Another limitation to this study is neutralizing antibodies that were not measured in this study. So that is also a factor. So this study is a good comparison between the two. However, the cohort that they have is very small. Okay, so they need to have like a significantly higher number of individuals in this kind of study for it to be a very kind of a valid study. This does have a point, and it does illustrate that it would be of use to have a bigger study on this topic. Moving on, because if Pfizer is not providing enough immunity to people who are 50 or older, they may be at risk for having severe COVID infections despite being fully vaccinated. So it needs to be studied a little further.